In the NHS Mental Health, Learning Disability and Autism Services, nurses, doctors and other clinicians are working hard to improve the lives of patients and their families and carers. Every world-class health service, however, must continuously ask itself how it can be more effective in the future. NHS England and Improvement is committed to continually reviewing the services they provide to ensure we provide high quality and timely mental health care for everyone who needs it. We are also working to tackle inequalities in access, experience, and outcomes. And we believe that our decision-making could be more collaborative and responsive, with patients and their families and carers playing a greater role in the decision-making process than ever before, and having their voices heard from board to ward. We also want more patients to be treated closer to their homes, communities, and the people that support them best. We'd like care pathways to be smoother and to make transitions between different types of services easier for everyone involved. So if it's the best thing for them, patients can return to their friends, family, and community more quickly. This is why NHS England's long-term plan has included extra funds and recommendations to improve the operation and delivery of specialised mental health, learning disability, and autism services. In the past, the decision-making for commissioning specialised services wasn't as integrated as it could have been, which meant the pathways of care could become fragmented. But pilot programs where local providers work in partnership to deliver whole pathways of care proved that a better way is possible. NHS-led provider collaboratives are a new type of clinically led operational grouping, led by a lead provider accountable directly to NHS England regional teams. They will take financial and clinical responsibility for the commissioning of specialised services for their local population, including children and young people's mental health services, adult eating disorders, adult low and medium secure services, and secure learning disability and autism services. These services will be developed by experts by experience in collaboration with local clinicians, local authorities, other commissioners, for example, clinical commissioning groups, and service providers such as voluntary community and social enterprise sector, with the NHS England regional teams providing support and oversight. Provider collaboratives will work with local integrated care systems and strategic transformation partnerships, which means they will be able to remove barriers and smoothly integrate community, acute, and specialized services, as well as design and operate high-quality local care pathways equally accessible to all that better meet patients' needs. The aim is to provide care much closer to home and with the least restriction and disruption as possible. With increased decision-making powers and experts by experience central to the process, provider collaboratives will be more able to implement local patients' and carers' views on how services should be run. Services will also be evaluated in a new way, moving away from the total number of patients treated and towards an assessment based on the outcomes achieved for those patients. By building a collaborative approach, we will improve the sharing of knowledge and resources amongst providers and commissioners and enable continuous improvement in local services. The pilot programs showed that treating patients closer to home, reducing unnecessary hospitalization, and ensuring decision-making involved patients and was clinically led was not only more successful and less disruptive for patients, but was also less expensive for the NHS. This added efficiency frees up additional funds for the provider collaborative to reinvest in the community, helping to pay for much-needed preventative programs and other early intervention mental health services. The provider collaboratives and long-term plan are a direct response to patient, family and carer feedback, as well as from NHS staff. They represent a moment of real change and an opportunity for each of us to reshape and improve how we work, both individually and together. In fact, there has never been a better time to have your voice heard or to make a difference to mental health, learning disability, and autism services. To find out more about your local provider collaborative, who to speak to if you want to get involved, or just to get some additional detail about how this change will affect you, your care, and your local community, please visit our website today. Further information can be found on the Provider Collaborative website, or just search online for NHS-led provider collaboratives.